Hi, welcome. This is Dr. John DeMartini. This is one of the most amazing and inspiring shows that you can listen into. If you want to be on the edge of your seats, if you want to open up your heart, if you want to expand your mind, and you want to meet incredible people, stay tuned because you're just about to experience a transformative radio show that will change your life. And you're listening to the Dr. Pat Show that's coming up right next.
Welcome to the Dr. Pat Show. Talk radio to thrive by. Powerful, inspiring, and coming to you live, bringing you stories of people like you and me, busting through and living life full out. Get ready to dare to wonder what your life would be like if you knew you could not fail.
Hey, everybody. Welcome, welcome, welcome. You all have heard me all week long talk about this show we're about to do today. You also heard me yesterday when I was talking with Lou Paradise, talking about Dr. Nooshin Darvish. And so one of the things I've said was that once upon a time, I woke up one day, April 1st of 2004, and my body, by the end of the day, wasn't the same as it was the day before. Something happened. People called it a mystery disease. It doesn't matter. What happened was I was able to find Dr. Nooshin Darvish, and I'm very grateful the way that happened, the way that God directed me to her. Why? Because both of us embarked on a journey that has led us to this day. The entire nature of my show changed. I gained an incredible friend along the way and a doctor that literally saved my life. Today, we're very excited for all of you to know that as the medical director and founder of Holistic Naturopathic Medical Center in Bellevue, Washington, and of course, Dr. Darvish consults all over the world, she is leading the charge, whether it is about integrative cancer therapies, anti-aging medicine, whether it's about how to detoxify the body, but most importantly, something I know that's near and dear to her, and that is the rise of chronic illnesses and her passion and commitment to not just understanding it, but to helping people heal. And that's what this is about for us. You're going to hear today about what it is she's doing in regenerative medicine and what Holistic is doing to really expand and broaden their vision and their mission to help people rid themselves of pain, also to look at how to be more vibrant, how to be living fully in a world right now where we are bombarded with toxins in our water. Latest right here in Western Washington, I don't know if she saw this on Como or one of the TVs, in our food. Today, we're ready to take on the conversation of stem cells, platelet-rich plasma, and much more. Dr. Darvish, great to have you.
Dr. Pat, thank you so much for the love and the passion and the service that you have provided the community at large and for me personally. You have been truly a good friend, and it's such an honor to be on this show and to have had this journey with you since 2004. It was actually my honor that you walked into my space.
That other space.
Thank you so much. I'm so grateful.
Well, so let's just really for a minute, because this is also part of regenerative medicine, what we're going to talk about today. I remember walking in and I remember saying, the angel lady told me to tell you that I need T3 therapy. And I remember what you said. You said something like, the good news is you don't need T3 therapy. And then you said the other good news is that we'll figure out what you need. And off we went on a journey.
And we're still on that journey.
We're still on that journey because we're living in a world. I had no idea over my lifetime how damaged the body and the cells could get. Now, here you are taking on another phase of your passion and commitment, regenerative medicine. Tell us what it is, because we hear these words, people throw things around, but from your perspective, what is it and what are you so passionate about when it comes to this?
Well, Pat, we truly live in an amazing time. This is a new age, right? It's when humanity, we are so imbued with new virtues and powers and new moralities, but most importantly, new capacities. We have been given, we have been imbued with these bounties and bestowals and perfections that are waiting and already coming upon us. So we are so blessed to live in this awesome age, and we have the capacity to see with our own eyes, right? We have the capacity to hear with our own ears and to decipher with our own mind. And so this is the time for us as individuals, as communities, and as the world to really build capacities. And when I say building capacity, I'm talking about the physical capacity, our mental, our emotional, our spiritual capacity. And these capacities are what we're going to use in this world to continue ultimately serving humanity, right? And so as we look around us, as we do the research, as we're studying and consulting the scientists, the doctors, we have individuals, we become aware of these cycles in nature, right? There's certain cycles in nature. There's the cycle of destruction and reconstruction, the cycle of disintegration and integration, degeneration and regeneration, right? So this cycle of degeneration and regeneration is present in every aspect of life, of nature, of humans, of plants, of our planet, of our universe, everywhere. So we see this, for example, in the seasons. Trees and plants have a cycle, right? They sprout new leaves, grow and bloom, and the flowers at some point, as we're seeing now, the wither and the leaves fall off, and the tree grows further and reaches this degenerative process at some point. But then it regenerates again in the spring. Now think about what would happen if we fed these plants water, like rain, nutrients, corrected the pH of the soil. These trees would regenerate even faster, bloom even bigger flowers, and strong, more magnificent and taller, right?
Yeah.
Well, so then imagine if we fed these things pesticides and herbicides and everything toxic, right? It would begin to wither and die. These trees will no longer have the capacity to grow tall and magnificent and bloom and have this amazing capacity to help us grow and be oxygenated and all the things that trees do for us. They would become weak instead, and they would become feeble, and they would hardly even have a oomph to regenerate. So we are at a time in medicine where we have come to the crossroads.
Yeah.
Right?
Yeah.
We have come to decide whether we're going to feed ourselves these pesticides, these herbicides that cause our cells to die and not have the capacity to grow and regenerate, or we have the choice to feed our bodies and minds and spirits what it needs, like the nutrients, the love, and the seeds that it will cause it to regenerate, reboot, heal, transform, and grow stronger, more vibrant with every season, with every cycle as we get older, right?
Yeah.
And this is truly the essence of what regenerative medicine is. It's giving our body what it needs physically, mentally, emotionally, spiritually to regenerate, to grow. Now, most of us, when it comes to thinking of regenerative medicine, it's, by the way, a very new word, right? First it was anti-aging, and now it's this thing called regenerative medicine. But really, regenerative medicine has been around forever. In fact, what I studied in school, naturopathic medicine, was really regenerative medicine. It's just been relabeled. But as we advance in science, we have gained new technology, and we have access. We have recognized things that we didn't recognize before. And we have become aware of what our own cells are capable of doing, that our own cells are able to heal our sick cells. We're able to find the healthy cells within our bodies or even with somebody else's body and use to help our own body heal. It's amazing if you think about it.
Yeah.
What we have been given. This is such a blessing.
And what's happening with what you're saying is we're opening up a whole new door. Recently, I presented in an X-ray that my ortho folks looked at of my left knee. What do they call it? An anomaly. See, I don't think there's such a thing as an anomaly. So here's the deal. What happens for somebody like me had a really serious knee injury back in 19 when I was 19, and they operated and they yanked everything out, right? And they expect you to walk. So I'm bone on bone. So all of a sudden they decide, why don't you try this natural thing? So they inject me with a natural substance, and it was natural. And the next thing you know, I don't pay any attention to it. And an X-ray shows I've grown a third bone in my left knee that perfectly fill the space. Now, what has that got to do with this?
First, well, that's regenerative medicine,
that's
right?
Exactly what I was going to say. That's exactly it. But you know what the shocking thing is, Dr. Darvish? Everybody's like surprised but me. And isn't that our challenge and our blessing? Isn't this now about educating and saying to folks, we're not necessarily creating something new. Thousands of years ago, people looked at how they can be vibrant and live and didn't put things in their systems that hurt them, even though they didn't have the science we have.
Exactly. And when you talk about your knee regenerating, it just shows us what capacity, again, we have. We have the capacity to heal. Our body has the capacity to heal. And why this is so important is because ultimately we are spiritual beings, correct? Yeah. And so if we have the capacity to strengthen our physical, we are able to strengthen our mind. As a result, this affects our spirit. And we become more vibrant, more powerful beings that can transform not only our lives, but the lives of communities around us.
Yeah.
Right?
Yeah. And, Dr. Darvish, I want to ask you about another word that we're getting quite familiar with, but not necessarily understand. And that's the language of stem cells. We hear stem cells. Once upon a time, a couple of years ago, you and I were first talking about this a number of years ago, where it was quite controversial to even say stem cell. How has this world changed? I think there's even like a stem cell magazine or something out there now.
There must be. Well,
you and I were like looking at, should we say stem cells? Should we not? Different world.
I was thinking about this question as I knew it would come up.
Yeah.
And it reminded me of a friend of mine that called me up a few years ago. And he said to me, I have multiple myeloma. And this is a physician from across the country that called me up. And he said, Dr. Darvish, Nooshin, you need to look into stem cells. And I said, why? He said, it's healing me. Multiple myeloma, if any of you know about multiple myeloma, it is a cancer of the bone, extremely painful, and there is absolutely no treatments for it.
Yep.
Except until now.
Yep.
And it is the stem cells, and specifically mesenchymal stem cells, which we'll talk about exactly what those are in just a bit, that started transforming his pain, started helping him heal, and started helping him get back to life and start practicing again. It was absolutely amazing. Now, what happened was 10, 12, 13, I don't know how many years ago, I was sitting in my fellowship for integrative cancer therapies over in Florida. And there was a group of us, 20, 30 doctors, maybe. We were the first group of physicians to go through this. Everybody was a medical doctor except for me as a naturopathic doctor, and we were all sitting there. And this doctor shows up, and he gives this amazing lecture on stem cells. And I'm thinking to myself, stem cells? What the heck? When am I going to use this stuff? This is good for these people. I'm going to just refer my patients over to the stem cell research over here in Florida, and I'll just go about my way, right? And a few years later, this friend of mine calls me up and says, you know what? You got to do stem cells. It's transforming people's lives, including mine.
Wow.
It was just amazing. So you asked me, what are these stem cells? Well, I call it baby therapy. My favorite thing is baby therapy. So these stem cells are baby cells, from which other cells are created and they grow. So if you think about the initial sprout of a plant, that's like a stem cell. Okay, from that one sprout, a plant blooms or sprouts into several stems and leaves and flowers, and it continues to grow, right? When we cut the plant, it kind of reboots it, and it grows new leaves and fresh flowers, and it's ready to go again with the right nutrition, the right soil, the right water, and the right light, right? That's extremely important. You can't just give yourself stem cells and say, okay, I'm ready to boot. You're not going to reboot like you want to be rebooted. Right? So we've got to think about that plant. It needs love, it needs nutrition, it needs soil and light and water. So our own stem cells are the same as that sprout of the plant. When conception happens, when that egg and sperm kind of unite, it's like the seed of that plant. Okay? And then this ovum, this fertilized egg, becomes and divides up into what we call stem cells. Mm. And from those stem cells, there is another layer of cells that are created, and then it regenerates into your liver, your kidneys, your heart, your lungs, your blood, your brain, everything else. Okay? But it starts with that seed that is sprouting. And as long as the mother is healthy, and the tissues within her are healthy, the nutrients that are given to this stem cells are going to be healthy, and they're going to grow and develop into a whole human being. Mm. Okay? Mm. So this is what stem cells are. Stem cells are those very, very early on cells that we all have. Now, the problem is that as we get older, these stem cells kind of degenerate. As we get sick, they kind of degenerate, because stem cells, remember, are there to heal and regenerate into new cells. So as we're getting older, as we're poisoning ourselves, as we're eating the junk food out there, we're eating the toxic tap water out there, we are stressing these stem cells, and they start to wither and die. And so they're not there for us to use to rebuild and regenerate and heal. Okay, so we can now use stem cells from other tissues in order to help our bodies to rebuild.
Yeah. That's the miracle, though, too. That's exactly what I was talking about. You know, you think about this thing that I referenced in my knee, and, you know, we sometimes see ourselves in our bodies as not so amazing, right? Mm-hmm. Right? When you think about the human body and what we're capable of, and the level of healing, and the level by which we can naturally ward off toxins, infections. I mean, it's not like you wake up one day and you walk out to toxic air and your body breaks down. It takes this body is constantly working. I mean, it's miraculous. So isn't then the conversation about stem cells natural right now in looking at ways that we can rejuvenate or regenerate our physical state?
Of course. You know, there's stem cells. These stem cells are really spectacular. They're magical. Okay? They're like little aliens with antennas.
Yeah.
Okay, they detect where they need to go. So when there is an area of inflammation in our body, and
Right.
keep in mind that for many years, most of us don't realize that there is inflammation in our body until it gets to the point where that cup overflows and you start having symptoms. I always tell my cancer patients when they walk in, cancer didn't come on overnight. Okay, it took at least 5 to 10 years before it showed up. And before that, there was inflammation going on for at least another 10 to 20 years. Okay, so if you've got cancer in your body at the age of 40, imagine how far back the inflammation started, right? So we may not be aware of the inflammation that's within our system,
Right.
but these stem cells with their antennas know where they're going. They kind of get attracted to the areas within our system that are stressed, inflamed. And they go there in order to reset, reboot, reprogram the cells in that area. Okay, so go ahead.
Well, I want to ask you about this because we're going to talk about this when we come back from break. If we look at this exactly the way you've beautifully put it out there, there opens up this door of infinite possibilities.
Absolutely.
You know what I'm saying? And
Absolutely.
That, I think, is what's different. That's the difference between when you and I talking about this today and when we started talking about it 10 years ago, right?
And that's what drives my passion. And I know that's what drives your passion.
It does. It does. I mean, part of the conversation, and we're going to talk about it today, is looking at, first of all, there's a reason you get to be in the place you are if you are really suffering from chronic illness, autoimmune, anything. There's a reason. And I learned that through you. It's not like I woke up one day the way I described, but that is the way it happened. It was years and years of not knowing what I was doing with my body. But even with that, Dr. Darvish, this is what's so amazing about this show today. Even with all of that, even with all of that wear and tear, even with all of that whatever I put in my body, there are still possibilities.
Absolutely. Absolutely. I see my patients that come in that have been on chemotherapy, radiation multiple times. And you would think, because this chemotherapy is so toxic, it will kill them. But it's amazing how vibrant and rejuvenated they become if they get their body to do what it needs to do, feed it what it needs, spiritually, physically, emotionally, clear away all the toxins and give it the nutrition and the prayers and the meditation and the love that it needs. The cells rejuvenate. It's fabulous. Yeah. It's fantastic. Yeah. It's magical. It's our creator.
Yeah, it is. I want to take a short break, everyone. But before I do, I want everybody to know a couple things. One, there are several ways to find out about you and find out about your work and the phenomenal team at Holistic. So I want to take a minute, and folks can go to drdarvish.com. But please just let folks know, too, how do they schedule an appointment? How do they find out more about everything we're talking about and begin their journey, if they haven't already, to see, whoa, these options are available? What's the best way for folks to find out about that?
Well, Dr. Pat, first of all, drdarvish.com, drdarvish.com is a good website to go to. Our clinic website is holistichealth.com, HOLISTIQUE health.com. So it's the French spelling, holistic.
Yes.
I'm Canadian, so I got to put that French twist to it. People can call to the front desk, 425-451-0404, and set up either an in-person consult, or I do video chats and phone consults as well. So if they want a personal consult, more than welcome to call in to set up a time. I would be very, very happy and very honored to help each one of you through your journey with anything that's going on. So
Yeah.
we want to look at the root causes of conditions. We want to look at the imbalances, correct the imbalances, and get your body back to regenerating and healing.
Yeah, and I want to really emphasize this because I send people to you all the time for a
I
consult,
appreciate it.
and I just want to say, even if you don't live in this area, this is really the new age of medicine right now. This is where it's not just enough anymore to have the internet and be able to Google. People really want to talk with someone and say, look, I don't necessarily live here, but I need some help understanding this, and this. And that, I think, is what you're doing and what your team is doing that is so far ahead of the curve, because people, the pain of illness is not just physical, it's mental and it's spiritual. And if you can't get information, the level that you feel of hopelessness is devastating. I am so grateful I did not have to go through that part.
Thank you, Dr. Pat. And yes, we do video chats with people from all over the world to help them through their concerns and get them back to life.
We're going to take a short break. When we come back, we're going to get right into it. So we mentioned a few things, but what is it that stem cells now, today, not 10 years ago, but what are the many ways, the possibilities that folks are looking at to address illness, disease, pain? What are the conditions stem cells used for? Let's take a short break, everyone. We'll be right back. Dr. Nooshin Darvish, I'm Dr. Pat. We'll be right back. Hey, everybody, welcome back. Yep, we are taking this conversation on. Dr. Nooshin Darvish is joining me here today for those of you out there. Regenerative medicine, stem cells, platelet-rich plasma, and much more. You know, in the first part of the show, Dr. Darvish, we were talking about and setting the stage for where we were, where we are, and the power of this conversation. Now, the question I ask you is, okay, introducing stem cells, enter please. And now, what are the possibilities? And what I mean by that is many folks don't know what this regenerative medicine can actually be used for. We think maybe anti-aging, but no, it's not that. It's much more, right?
Well, definitely. And much more that we don't know about. This is what's so exciting about all of this, is that as we're researching, we're realizing what is happening to people and what opportunities and possibilities are there. I give you an example. I had a patient in a few months ago, and he came in because he wanted some hair growth. So he was losing some of his hair, and he didn't want to lose this patch here. And so he said, you know, do some stem cells on me. I said, okay. So we started doing stem cells. We did one set, one visit. And then 3 months later, him and his wife came in and they said, my bipolar has pretty much resolved. And I've decreased and pretty much off of my medication. And I don't have bipolar anymore, it seems like. I'm like, wow. And I still haven't heard from him because I'm sure he's pretty stable with his bipolar.
Wow.
Right? And so these are things that we don't even realize we're doing to people when we're injecting one thing, what's happening with people in other ways. What I tell people is that we're not treating a disease. Although, you know, people come in for pain, autoimmune diseases, diabetes, heart disease, all sorts of issues, but we're not treating them for their disease. We're giving them baby cells to reboot and reprogram their system and see what wellness is created in their body, right? So it's all about creating wellness within your system. Now, these stem cells are fascinating. We talked about how they have these antennas and they go to these areas of inflammation, right? But what they also do is they modulate your immune system. So for instance, somebody like you, where you've got an autoimmune response going on, where your immune system is on high guard and on attack,
Yeah.
Right? These stem cells are able to take that high attack and calm it down. And so that your immune system is no longer so hyperactive. So they almost act like an immunosuppressant. They suppress the part of the immune system that is involved in autoimmunity, but they activate the other part that is needed to fight infections. Okay, so if you've got chronic infections, people with Lyme disease, with cytomegalovirus, with all these chronic infections, stem cells, the research is showing that maybe there might be some benefit there too.
Yeah, I was reading an article not too long ago, and the question was asked. I can't remember the exact place. It says what diseases, right, could be treated by stem cell research, and the answer was, well, in theory, there's really no limit. And then I can't remember exactly, but the interview went on to talk about that, and it's exactly what you're saying. There is no limit, because when you combine that awareness now with science, right, now with what we know about healing, right, we can be very, very specific about it. And at the same time, what you're discovering and many others are discovering, we don't even know what we don't know.
Exactly. So, these cells are able to regenerate the pancreas. Actually, the beta cell in the pancreas is what releases insulin. And with people who are suffering from either type 1 or type 2 diabetes, they're showing that these stem cells actually regenerate those beta cells. They're showing that stem cells will divide up and regenerate into liver and heart cells. They can reprogram our metabolism. Okay? It's really, really amazing what bounties and technology and love has been instilled in our time, in our being, in this generation at this time. It's absolutely amazing what we are discovering with these stem cells. Yeah. But go ahead.
I want to ask you, though, along those lines, we're not just talking about necessarily tissues. We're also talking about nervous system. We're also talking about bones, right? A lot of information around bones. I think this started with the sports industry with the bones.
Exactly.
But we're talking about that. So nervous system, we're talking about bones, we're talking about cartilage, we're talking about liver.
Yes. Amazing. And yes, stem cells have for the longest time been used to rebuild tissue in the joints. So for osteoarthritis, for rheumatoid arthritis, for any kind of ligament tear, for injuries, sports injuries, rotator cuff, it may not necessarily be needed to do surgery anymore. Depending on the type of injury you may have, stem cells may regenerate those tissues. But again, the tissue needs to be regenerated with a fertilizer. Right? You can't just put the seed in the soil and expect it to grow.
So tell us about that, because that's part of the conversation we don't really look at, right? We don't really look at it. You're absolutely right. I mean, almost everything that we grow requires nurturing and care, or requires an igniter, or requires an activator, or a catalyst, whatever you want to call it. I mean, even your best shot, you throw stuff in the ground, you got to put a little water on there.
Exactly. Well, these fertilizers come in different forms and shape, and oftentimes they work together. So when we do stem cell therapies, the research shows that the environment, the milieu, is really important.
Yeah.
Right? And so correcting that milieu, which is making sure that you're on a right diet for you before you do any kind of stem cell therapy, making sure that we have balance to your hormones before you do stem cell therapy, making sure that you have the toxins detox out of your body to make sure that you have the right environment, the pH is correct in your body. These are all really important aspects of us as beings in order to allow those stem cells to heal and regenerate. But when it comes to, for instance, joints or hair or collagen, for instance, we're finding that when we mix the stem cells with your own platelet-rich plasma, the platelet-rich plasma, because it contains a lot of different growth factors that stimulate these cells to grow, it's like giving it direct fertilizer. It's like giving the stem cells fertilizer. Okay? So I make sure that the body has enough oxygen, enough food, hormones are balanced, toxins are rid of, the mind is clear, and then get your platelet-rich plasma from your own blood, which is a very easy process. It's just a blood draw, this fancy little machine that spins it down and separates out the platelets, which are full of growth factors. They have at least 7 different types of growth factors.
Wow.
And combine that. Make sure that you're testing good for your own blood, because some people do have a reaction to your own blood, and I don't necessarily want to use the platelet-rich plasma if you're having a reaction to it. Okay, so there is a lot of intricacies that we look into in order to provide the optimal benefits of the treatments that you're going to get. It's not just, okay, come in and I'm going to give you a shot and you're going to go. Okay, it's not about that. It's really looking at you as a whole person. It's looking at to see where the deficiencies and the toxicities are, imbalances are, correcting those, and then giving it the seed. You know, you don't just go plant a seed. You have to kind of prepare that soil first. And that's what we do before we give you stem cells.
I want to get back to one of the things you said at the top of that, which was, I think you said we have to balance hormonal balance. Let's talk about hormones for a minute.
Oh, that's a totally different topic.
It's a totally different topic, but I didn't want to kind of blow by it without at least touching upon it. And I hope we do talk about that. We have one of the greatest misconceptions, I do believe, as women, I don't know about the men, as women about what that means. And the reason that we do is, at least in my own journey, I went through a period of where the solution for that imbalance was birth control pills. Do you remember? Not too long ago. It was like, okay, we're going to give you them birth control pills, and that's going to do something. Fast forward to now, we have learned so much, not just about what I'm referencing as, you know, the body changing, but now we're learning about human growth hormone naturally. We're just learning. So the simple conversation about hormones that occurred decades ago has now opened up. And so I found it fascinating. You mentioned that is part of what we have to look at here.
Exactly. And you're absolutely right. What we knew or what we used decades ago was, and still is being used, sadly, is, you know, you've got hormonal imbalances. Let's give you birth control pill to reset you, reboot you, and reorganize your hormones. It doesn't work that way with birth control. It actually suppresses the hormones. It's synthetic. And so it suppresses the hormones, and it is a mismatch to our own body's own hormones. And so it can cause an increased risk of, you know, now we're finding hormone-related cancers, breast cancers, ovarian cancers, all sorts of different cancers. But what we're talking about when we say hormone balancing is looking really at the way your body's processing hormones, detoxifying these hormones. Because if you're detoxifying the hormones in a wrong pathway, then you are getting set up for cancers, hormone-related cancers.
Yeah.
And, you know, most people don't know this, but there's a rise in brain tumors. Those are hormone-related cancers. Hormone-related cancers.
Yeah.
Lung cancer is a hormone-related cancer. Colon cancer is a hormone-related cancer. So we're not just talking about prostate cancer, breast cancer, uterine cancer, ovarian cancer, all of these other cancers that is so common in this country are hormone-related cancers, which
Wow.
means that they feed off of toxic hormones, not the healthy hormones. And if you think about a 16-year-old teenager whose hormones are raging high estrogen, high testosterone, high progesterone, high growth hormone, they should be full of cancer, right? But they're not, because these hormones tend, when they're done properly, when we use bioidentical hormones and in an appropriate manner, they should create wellness within our body. They should give your body that fertilizer.
And the reason I brought it up is because what I know about you that the people listening may not know about you is that from the get-go, and I don't remember your exact words, my version of it is one size does not fit all. And what I learned about that is we're all different. We're all unique. We're not just one body system. And we have to look at where we are in our life cycle, in our healing journey. You know, not everybody has taken in the same toxins. Not everybody has eaten the same food. And that's why I wanted to get back to it, because one of the things that you do is you look at these. Now, fast forward to FDA approved joint pain. Now, fast forward to the various kinds of stem cells. And we have to look at the best and safest approach for our body.
Exactly. And extremely personalized and individualized for you. Because you're absolutely right. I have a different, even from the time I was conceived, the environment I was in is very different than the environment that you were in when you were conceived. The physical environment, the emotional environment, the stress environment, spiritual environment was very different. We're two different people, right? Even though we may present with similar diagnoses. I was diagnosed with rheumatoid arthritis when I was 19 years old.
Yeah, I remember. I know that.
Right?
I know.
And here, I've never taken medication. I don't have any issues with any of joints. I don't have any problems. But it's because I've worked at, and I continuously work at, rebuilding, regenerating, rebalancing, detoxifying, spiritualizing, connecting, meditating, praying, eating healthy, exercising. It's a lifetime of work.
It is a lifetime. It is. I'm listening to you, and I'm. Oh my gosh!
It's a full-time job.
Yeah, I need a B12 shot. But the thing I want to say about that is, it is through our own experiences with illness that you and I are here today. You see, because part of this is to remind people never to lose hope as well. I know you, but maybe many people are hearing you for the first time. You and the team that you work with are extraordinary. You are right up front and care so closely for the safety of people, for the wellness of people, for the safety of administrating care for people, for thinking things out clearly, for not giving somebody something that their body is not ready for. I mean, it really is a process. And that is a lost art, by the way, in care. That is a lost art. And that is one thing you and your team there at Holistique have never compromised on. It is way too important because we have complex diseases now.
Yes, we do.
Yeah.
Tell me about it. Yes, we do. And thank you for that. Thank you for that. I always tell my patients that it's not just about taking vitamin D and vitamin C and eating organic and, doing stem cells and doing IV vitamins B or whatever it is. It is about the timing at the right time in the right order. So if you think about your body as the combination lock, okay? That lock will only unlock if you put the numbers in the order that it needs to go. If you've got 12, 15, and 30, and you just put them in randomly, that thing does not unlock, right? It's the same with our body. We need to put the things into the body in the proper order at the proper time. And people come in and they want a quick fix. Well, that's what our society is about. And that's what I don't specialize in. You want a quick fix? I'll send you to a medical doctor who specializes in giving you a quick fix. What we're about is getting your body to do the healing from deep, levels, at the cellular level, at the spiritual level, emotional level, physical level, mental level, getting your body to heal. And that takes time, it takes love, it takes passion, and most importantly, it takes patience. It takes patience. And that's what most of us in this society don't have right now. We want the quick fix. But the more we want the quick fix, the quicker we get into danger zone.
Yeah. And for those of you just tuning in, please go to drdarvish.com. The other thing we're talking about is we're not talking about a patch. Okay. You know what I mean? So, when you get your tire, it gets on a nail, right?
Yes.
You get the tire on a nail. And what happens is you have to get from where you are. So you patch the tire. But you know that it is absolutely not going to last if you throw that patch on there and you get on the highway at 65 miles an hour. You know that it's a short-term fix. See, the difference is we're talking about going through and allowing the body to fully heal at the root cause and then all of the peripheral, so that when you move forward in your life, you're not having to come back and get a new patch in that same way. Exactly. That's the difference. Do you want to live vibrantly, or do you want to constantly be getting your tire patched?
Exactly.
Strange metaphor, but
I know. Dr. Pat, I just want to go back to the stem cell conversation a little bit more.
Yep.
Because there is a lot of confusion out there, and I want to just clarify what stem cells come from and where the best options are. So,
perfect.
We can get stem cells from, we think we can get stem cells from placenta and amniotic fluid, but it's not very potent. And amniotic fluid and placenta tissue have a lot of growth factors and anti-inflammatory, what we call cytokines, and collagen and all of that. They act more like the platelet-rich plasma. So they're important, but they don't give us the amount of stem cells that we want. And we want really mesenchymal stem cells. The research today is showing that mesenchymal stem cells are those baby stem cells that are the most potent in regenerating and rebooting the system. So then, the conversation comes to bone marrow. Should we get a needle in there and aspirate some cells from the bone marrow? Well, remember how I told you that these cells have magnets? They're like these antennas, and they go where the area of inflammation is. Well, you take a sample from your hip, and then you inject it in your knee. Guess what? It will travel back most likely to that original hip where you got the bone nicked, right? Because that's the site of acute inflammation. And so that's why these cells are decent, but they're not as applicable. And also it depends on the age. The older you get, the less viable mesenchymal cells you have from the bone. Same with the adipose tissue, the fat. It's a similar kind of a thing, although we can get more from the adipose tissue. But again, as you get older and the more sicker you are, the less stem cells. So what we end up doing is getting the cells from what's called umbilical cord tissue. It's the Wharton's jelly. It's the jelly that surrounds the blood vessels in the cord. And this is from live babies. The mothers have donated them. It's not killing any babies, or they're not aborted babies. It's a very safe, ethical practice. But these stem cells are tested and rechecked and tested to make sure that they have what markers they need to be called a stem cell to be active, but also that they don't have the markers that would signal a graft-host disease, where you get a reaction. So many people concerned about that, but it's actually really not an issue. So the mesenchymal stem cells from cord tissue, not cord blood, tends to be the most effective that the research is showing to get the most viable, along with all the growth factors, all the anti-inflammatory cytokines, everything else we need to get the cells to reboot and the body to reheal.
I'm so glad you brought that up. I think that is a really important aspect of what we're talking about, because there is so many misconceptions about this, and we're going to do more shows about it.
Yes.
I think this is an important conversation to have because of the possibilities. The other part of it is because you all have been out in front of doing this, right?
Yes.
Years out in front. So not only are you prepared, but you have looked at the scope and you have results. You've seen what it can do. Dr. Darvish, I want to thank you. I know this hour has gone by quickly. Again, I'd love to know. I know it goes back. How can people find out? And what's your personal message? By the way, Dr. Darvish and I know you're already texting me. We're going to be doing this on a regular basis. How can people find out more about you, and what's your personal message?
Again, our office number is 425-451-0404, and drdarvish.com, probably the easiest way to get into the whole system. And, again, remember that we live in a new age at this time. We are imbued with new virtues and powers and new moralities and capacities. We are given new bounties and bestowals and blessings. And so this is the time for us to build our capacity to transform our life. We have the capacity to transform. And so keep in mind that prayer, meditation, creating a really beautiful sacred space with your own creator, providing service to humanity, asking for assistance, most importantly, being grateful and loving yourself and others, and knowing that you are always loved. So remember that you have the capacity to transform.
Dr. Nooshin Darvish, everyone. I'm Dr. Pat. An honor and a blessing as always. Thank you so much.
Thank you, Dr. Pat.
Wow. Thank you, all of you, for tuning us in and turning us on. Carter, thank you for hitting all the right buttons. And most importantly, for those of you out there, don't ever, ever, ever give up hope. Many blessings to all of you and Dr. Darvish. We'll see you next time.